Hello, everyone. It's Phil Jacobus. It's here at Healthcare Business News. It's September 9th at 3 o'clock in the afternoon. I'm in my office in New York City. And today we have the good fortune to be joined by Aneesh Chopra, who was the former CTO for the Obama administration. A very interesting chap. I heard him speak one morning on Squawk Box, and I was really impressed. And I feel lucky that we have him joining us. But before we're joined by Mr. Chopra, let's take a look at a couple of stories that are in today's Healthcare Business News Online. You see as we talk about COVID-19, you see where some Louisiana radiologists did a study on chest x-rays and how they can help with COVID-19 diagnosis. We've talked about this before. This story has a little different twist to it, so I encourage you to read through it. And there's another story, a sad story about these hackers that are screwing up everything. 56,000 records were hacked at Northwestern Memorial Healthcare System. It's a shame that these people don't have something better to do, but also, there's a story about how the FDA has cleared a Fujifilm's technology for a COVID-19 indication. So that's also another COVID story. So it's still in the news, and unfortunately, it's still a problem. And now I'd like to welcome Aneesh Chopra, who is the co-founder and the president of CareJourney in Washington, D.C. Aneesh, thank you for joining us.
Thank you for having me.
You know, our viewers and readers are mostly healthcare providers, but for those who are not familiar with CareJourney, can you tell us just a little bit about that?
Sure. CareJourney in many ways is the manifestation of the work I led in government to open up healthcare data and ensure that it can be put to its highest and best use. CareJourney's mission is to ensure that individuals and organizations they trust can help them make the most appropriate decisions at every step of their care journey. And we are pleased and honored to serve over 60 plus health systems, health plans, and other stakeholders working to make the consumer's experience better in healthcare.
Okay. Would you agree that the coronavirus pandemic has provided a reminder that our public health data management leaves something to be desired, and how would you say that?
The easy answer is yes, but I think it's also a bit of a reminder that when we have change in the healthcare IT system, we have to do our best to make sure that all parts of the healthcare ecosystem benefit from that investment. So the very same doctors and hospitals who spent a decade buying and upgrading their regulated electronic health record systems, there really should have been a marketplace of apps who are capable of connecting and communicating to those systems. You would think that public health could have had an app by now, or health plans could have apps, or consumers could have apps to tap into those data sets. It's taken us a decade to move from regulating the documentation of information that goes into a box to regulating how applications outside of that box can connect safely and securely into it. Thankfully, the troubles that we're seeing in public health have simply exacerbated the pace with which we believe the industry will shift from regulating entry to regulating access.
I see. You know, as a tech policy expert and a former CTO under the Obama administration, you know a lot about interoperability and privacy issues. What sorts of things are standing in the way of the ability for different healthcare providers to work together efficiently?
Today, it's mostly mindset and business model, not technology. And so let's go through each of these aspects. You know, HIPAA is misunderstood. Whenever a loved one, and touch wood, my family is largely healthy, but whenever a loved one has to get healthcare, there's often this discomfortable moment when we ask for a copy of the medical records, and the physician or the health system sort of looks at us and says, what do you mean? And okay, you can log into my portal, but you know, HIPAA, I'm not allowed to share that with you. And so mindset to me is a reminder that HIPAA had two provisions. One that constrained information sharing between doctors, hospitals, and other stakeholders, almost not necessarily behind the patient's back, but almost sort of outside of their purview. And the basic principle there is that we should share the minimum data necessary to perform a treatment, payment, or operation. And that's the part that's governed 99% of what we think of health HIPAA today. But the other provision of HIPAA was a right of access, that if a consumer asks for their health information, it is the health organization's obligation to make that information available to me in a form and format of my choice that is accessible to the IT systems that the doctor or hospital has. That right of access almost was forgotten because all the investment had been how the health insurance companies connected to the hospital systems and all the rest. So the provisions that we're now implementing, the consumer's right to connect an app of his or her choice, are almost the same principles that were enshrined in the original statute, just without the IT. And so mindset to me is the biggest barrier, that we acknowledge that the consumer has the right, as opposed to we're going to constrain the traditional B2B use. The second is business model. And it is complicated in healthcare when we have a fragmented, decentralized delivery system, which, by the way, in theory, we thrive in and enables competition and creativity and innovation. But somehow it puts a burden on the patient to stitch together their information. And if they wanted to use that information to shop, that inevitably would mean that the organization that holds the information is likely to lose on the margin. And so if the incentives are that I share and likely lose future customers, that creates a bit of a disincentive. And so I get why the market hasn't naturally made it incredibly easy and simple to allow individuals to take their information and move to another doctor or another health plan. But yet here we are looking to make the healthcare system better, grounded on the principles that the consumer and the best interest of that consumer should be put at the center.
And we have to believe, I guess the underlying theory is that more information provided to more patients would result in better patient outcome.
And the reason that sentence to your listeners feels hollow is that almost every study going back a decade or two, where you put, quote, information into the hands of a patient, even the famous Pennsylvania mortality statistics on heart surgery, where you can show a patient hospital X will lead to a higher probability of death than hospital Y, patients will still go to hospital X if it's where their physician recommends they go. And so I understand there's a bit of a hollow view that more information will somehow change what we've been witnessing for 20 years. However, I believe there are two reasons why more information is actually going to be more useful in this era. Number one, applications can convert that raw information into very tangible decision support. In the behavioral economics world, think nudges. So all of my medical records in the hands of an app I trust, in theory, could mean that I get 2 or 3 important reminders that last year I got the flu shot at this date. I should ask to schedule it now so I don't forget. And you change the default setting on good behavior. The second aspect is payment reform. If it was just me building apps for myself and my family, that there's hobby shops and other places I could go. But if my primary care doctor, whom I otherwise trust to be my quarterback, is now financially incentivized to organize my total cost of care, this move to value, I believe primary care doctors are in the best position to organize these applications and to ensure and curate that the advice that's given to me reflect their clinical judgment based on the information that's held. A primary care physician's app I trust that can aggregate all of my health information and ensure that I make the best decision at every step of my healthcare journey, I believe holds the key to reining in healthcare inflation while boosting quality.
I see. The app you're talking about an app which is different than something like MyChart or
Correct.
Epic, right? And
Those are lockers for the most part. They're places you store the data. And we call those personal health records going back a decade.
Right.
But now think about the financial services industry. And there's a whole menu of places that say, if you allow me to connect to your checking account, I can tell you you qualify for more cost-effective borrowing, or that you'd be a great candidate for refinancing, or any number of recommended decisions. And it is a set of decisions. Do Americans today take the best decisions for their health? Do we take preventive services? Do we get the annual wellness visit? Do we ensure we get the flu shot? When we leave the hospital and we go home, do we go back to our primary care doctor to make sure the discharge instructions make sense based on the medications I was taking and what I'm doing in the future? These sort of fundamental behaviors, sadly, are not the norm in the American healthcare system. And so the question is, how can we organize the information to encourage folks to do that?
I think you might agree that the adoption of digital support through the hospital has been accelerated during the pandemic.
By necessity.
By necessity, and it is a sort of a silver lining in the dark cloud. How would an app, this sort of app, if it was universally used, have made or changed the way we dealt with the coronavirus or the pandemic in general?
I see three things. Culture. People are now comfortable. Medicare beneficiaries went from maybe a couple 100,000 a year accessing telemedicine to now north of 9 million as of July. And what that means is we now understand that we can communicate with a physician, have a reasonable conversation. Certainly in the medical specialties, we'll see what happens on the judgments around procedures. But at least on the medical specialty side, I think there's a culture change. This has been technically capable, but not trusted. And now by necessity, we've gotten used to it. And it actually may actually be the default preferred option. We'll see what happens. But point number one is I think the culture setting changed. Number two, and this gets to the application issue, talking to my own physician, whether virtually or in person, is different than talking to a team of physicians, some that may be available when I need them and others when I'm available to meet them on their schedule. And when I have more than one physician communicating with me, it is imperative that they communicate with each other. And if they're not on the same electronic health record, then the chances of that sharing are much lower. And even for those that quote unquote interoperate, the kind of information that's shared may be a 60-page basket of junk, not the pithy 4-sentence note that explains the critical issues in my care plan. So we need to have a solution for the fragmentation problem. And not just the fragmentation problem, but maybe some of that decision support for context. So when Dr. A finishes the consult and shares some of those notes, Dr. B not only can read them, but maybe if there isn't as much time to read the 25 pages of context or history, has some decision support that say, here are the 4, 5, 6 things that are really important to ensure that this person's care is coordinated appropriately. That is where these applications best fit, stitching those pieces together.
Now, does CareJourney offer this sort of apps, or do you
No.
You're just advising hospitals that they should do it?
No, great question. I want this capability in the hands of my parents and my loved ones, but I am not an app developer, and CareJourney doesn't build apps. However, in order to do this the right way, we do want to understand what is the healthcare system doing today for patients like my mom and dad. So we at CareJourney, we have a license to the National Medicare Dataset, and we mine that information to identify groups of patients by their clinical and other characteristics that are suffering from fragmentation in the system today. In addition, we look for those physician networks, those health systems that are delivering exceptionally well-coordinated care. And the identification of best practices and the rapid dissemination, that is the core mission of what we do at CareJourney. And I'm hopeful when we see the abysmally low flu adherence rates, when we get into the COVID, wave 2 or 3, depending on our definitions, that we have a much more focused plan nationally to boost up the flu shot participation rates so that we don't get hit in the ERs in the fall with the double whammy. So CareJourney's role is to help maybe provide benchmarking and context, and to, of course, demonstrate that this is all legally possible, and to drive a membership of health systems towards that future together.
I see. Well, as I predicted, you're a very interesting guy, and we're lucky to have you with us today. So I want to thank you for joining us.
Well, I appreciate you taking the time, and I wish your listeners well. I'm very hopeful that their families stay safe during this pandemic, but we take to heart the lessons. And to summarize, we do need better digital infrastructure for public health. Hopefully we can build on the regulated systems that we're going to use to make our daily lives more effective. And we got to move to a new delivery model where I can coordinate the otherwise fragmented system around my needs via applications I trust. And if we put these pieces together, I have high confidence we're going to have a wonderful healthcare system that will be the envy of the world.
Well, from your lips to God's ears.
Thanks for your time.